Hi, my name is Chelsea Anich. I'm an FCJ nursing student. I'm in term 2 in section 5. Today I'm going to be hanging an IV medication via Piggyback. So I'm going to start by looking at my MAR to see the doctor's orders. Today the doctor has ordered Flagyl IV via IV at 500 milligrams every 6 hours, mixed into 100 milliliters of normal saline. So I'm going to look at my drug card. The action of Flagyl is bactericidal. Its purpose is to kill anaerobic bacteria from an infection, and my patient has a urinary tract infection, so we're going to try and get rid of that. The recommended dose is 500 milligrams every 6 hours. The side effects are superinfection, dizziness, headache, and aseptic meningitis. Contraindications include hypersensitivity in the first trimester of pregnancy, as well as severe hepatic impairment. The nursing implications would be to obtain specimens for the culture and sensitivity before initiating therapy, to monitor the INOs and assess the IV site for phlebitis, rash, and infiltration, among other things. I'm also going to check the labs, and I noticed that the patient has an elevated white blood cell count, which indicates an infection. So since the doctor ordered 100 or 500 milligrams of Flagyl, I'm going to we're going to do 100 milliliters over an hour, and the drop rate for that would be 17 drops a minute. So I'm going to start by performing hand hygiene, and I'm going to draw out my medication. So I've got my sterile syringe and needle. Since my medication bottle says that it is 1,000 milligrams per milliliter, I'm going to go ahead and draw up half a milliliter since it's half of that, since I need 500 milligrams. So I'm going to clean off the top. I'm going to draw up half a milliliter of air.
I'm going to label the tubing with the date and the time of my initials.
Draw back half a milliliter of Flagyl.
That's okay. I'm sorry. When you were doing great otherwise. You started me. I did the same.
And now I'm going to go ahead and put it into my saline.
I think you're welcome.
So I have to fill up the medication. Basically, 6 milliliters and then put it in.
When you're ready.
I can't do
Hard stuff. This is easy.
Okay.
This is
Alright, and then I discard this into my sharps container. And I've got all this ready, so now I'm going to take my medication, my alligator clamp, and my tubing into the patient's room. Hi, Mr. Smith. I'm Chelsea. I'm going to be your nurse today. Your doctor ordered that we give you some Flagyl to get rid of that urinary tract infection. So I'm going to go ahead and I'm going to check the patient's wristband for name and date of birth. And then I'm going to assess the IV site. Again, make sure there's no phlebitis or anything abnormal, and it looks good. So I'm going to go ahead and write up my medication label, which has the patient's name, the dose, route, and frequency. So that is all set. I'm going to go ahead and now I'm going to prime my tubing. So I'm going to perform hand hygiene. I'm going to get my gloves on.
Treatment of serious infections in susceptible organisms, designed to bacterial cell wall membrane, causing the cell's death. Also, on the morrow, check the patient's allergies. Side effects are seizures, anaphylaxis, pseudomembranous colitis, and serum sickness. Before I gave the medication and while the patient was receiving it. Before I gave it, I did the culture and sensitivity test, and then
now I'm going to go ahead and get my tubing ready.
Again, check the allergies and assess the patient's. So
Go
the dose is 3 grams and every 6 hours.
Take this off.
And it comes in a unconstituted 3 milligrams vial. So you reconstitute with 6 milliliters. And I have that here.
Make sure I have it clamped off.
And 3 grams of Persephone, or not Persephone, Zocin. And it's going to be going in over an hour. And the 6 milligrams or 6 milliliters is going to be going into 50 milliliters of.
And I'm going to prime the
So
drip
that's on
chamber.
the sheet to show the mouth. So it's 56 milliliters over 1 hour. So it's 56 over 1 times 1 over 60 times 15 over 1. And that would be 14.
That's all set. Alright, so now I'm going to go ahead and clamp off my primary line.
And that's all. So I can
Okay.
go ahead and
Hands off. So I'm going to apply my
the
tubing label
IV
as well, which
solution
just has my
with the drug
name
dose
and or my initials and the date and time of
initials.
the administration.
Drug dose time.
I'm going to go ahead and lower the primary line.
So I'm gonna pull out, draw out my 6 milliliters.
And then I'm going to go ahead and clean
Swab.
the port with another alcohol swab.
Put 6 milliliters in. Bottle, so I can take 6 out.
I've got the primary line clamped off, so that's all set. I'm going to remove this and attach it to this. And now I'm going to go ahead and unclamp the piggyback line and establish the flow rate, which is 17 drops a minute. So I've finished with that. I'm going to monitor the IV site and make sure everything goes well for a minute, and then I'm going to leave the patient and come back in an hour after the medication has completely infused. So it's been an hour. I'm going to come back. I'm going to perform hand hygiene again and put on my gloves. We're going to go ahead and disconnect everything since it's done infusing. So I'm going to start by clamping off the piggyback line again. I'm going to remove the line and apply an alligator clamp to it so it can be used at a later time. Okay, and now I'm going to go ahead and unclamp the primary line so that that can start infusing, and I'm going to reestablish the flow rate. I'm going to discard all my materials, remove my gloves, and perform hand hygiene. And then we are done here. I'm going to reassess the IV site, make sure there's no phlebitis or anything. And then I'm going to go ahead and document in the MAR the medication that was administered, the time, route, and drug and dose that I gave the patient, the condition of the IV site, and it was good. And then I'm going to record the volume of fluid that I used as well as the INOs.